taking it under this outline. Why are we doing this topic? And it says that we should pay attention to when making a PowerPoint presentation at the format of the PowerPoint slides, the fonts that are used in typing, the use of pictures, our body language, timing of the presentation, then talk about review of the presentation. It's important that we have standards. We present in different manners, and we have noticed that sometimes if we say comments is 15 minutes, 20 minutes after the presentation, we may spend 5 minutes or 10 minutes shouting and quarreling about you didn't type this well, you didn't put the picture properly, things like that, and it takes time. Our aim is to have a standard. The purpose of putting them in red is to tell you what not to do. Why I got this information from, this was how it was presented with segments like this. It says to make clinical meeting presentations more standard. If you notice carefully, both bullets are transmitting the same information. Do you agree with it? But which one do you think is more appropriate? Even though we have not gone to practice, which one do you think is more appropriate? The first one, isn't it? So, with just 4 words, we are able, or the presenter is able. I say I've corrected myself. I said therefore, you are able, which is second person, went to we are able, which is plural first person. So the presenter is able, which is third person. Because we are going to talk about that presentation. So listen to yourself and interest. So following these principles, the presenter is able to summarize his points and make it more succinct. So we are going to see good and bad examples. And you can already see a picture there, even though it's not necessary. But pictures make it more interesting, more friendly, not just plain. The first point is the format, and the rule is 5 by 5. 5 by 5 rule for PowerPoint presentations. Very simply, we should have not more than 5 lines or 5 bullets per slide. So this slide, how many bullets do we have? 1, 2, 3, 4. Is the second and third, the third and fourth bullet that I have short bullets. You can see that it is easier to read, not crowded. So 5 bullets, before we were talking about 6 bullets per slide. So 5, 6 bullets per slide. And not more than 5 words per bullet. Why is this important? People cannot listen and read at the same time. You may think you can multitask. There's really nothing like multitasking. You cannot be listening to radio and operating and reading and answering at the same time. Your brain is switching from those 4 things very fast. You may not see it, it's really not, but it's happening. So when it comes to meetings, people cannot listen and read at the same time. So in a PowerPoint presentation, the presenter should try to make the reading part reduced. If it is to read, you will just share the slide. Everybody go and read this topic, management of investment structure. But the essence is to talk. So the meat of the meeting is the presentation, is the verbal presentation. It's not what is projected on the slide. Remember that before we had computers and projectors, there were clinical meetings going on. I remember when I started listening this, my experts were shouting on us that we were this because we had this. They didn't have this. They told us that they will need to go and there's this transparent slide they used to use, like a nylon paper. They will write on it or type. Then they will not put it on something that will shoot light. The light will not be reflected by a mirror. So they felt like we that were coming, we had more technology. Why are we giving the excuse of the system has crashed? Of course, no residents will be this. They didn't like it. So the essence of it is that even before this PowerPoint thing and this projector, people were presenting. Even before those projectors in the 1970s, our great teachers, they didn't have all these things, and they had clinical meetings. They had to present these topics by mouth. So the meat of the matter is what you see. Don't let what is on the slide take over your shine. So the one in red shows, don't put them, the one in red is how the original source document came. It says don't put them in a situation where they have to do an English script. But the one in black is a more succinct. You can see that we compressed it, although not perfectly, but it's better than the second one. How? So we should use phrases, not whole sentences. So the phrases should just be enough to remind the presenter, this is the point I want to talk about. And then you develop it. It's your topic. If they wake you up, you should be able to say, okay, the result from the randomized study of localized orientation request after Lopeto over 65, you read that journal. It's your topic. If they wake you up to talk about it. So the PowerPoint is just to remind you that this is the next talk about. So in some way, 5 bullets, and each bullet should not have more than 5 words to make it compact. Of course, these are guides. Sometimes it's difficult to keep, but let it be matter. Second point, the font size. Font size for the titles. That font on top is title. The ones below are the body of the presentation. The font should be like 24, and then the body should be smaller. The second bullet there is showing what font design means. There shouldn't be more than 2 font designs per slide. I have put 3 font designs there. ABC in capital. First one is ABC in Times New Roman. The second one is ABC. The third one is also ABC. There are 3 different fonts. There shouldn't be more than 2 fonts per slide. It is not an artistic gallery. It's a scientific presentation. The essence is that it's easier for people to read when the fonts are not too different and it's not tidy and clear. The way you should do this is to choose the template for each slide and pick to it. Now you can see that I have struck out before you log begin. This was how the main presentation came. But I struck it out to let you know that without that those extra 3 words, you can still pass your message. So a summarized bullet can still pass the message by being over in word. Then the third bullet, people need to read quickly in word, can be compressed to quicker to read. So if you as a presenter remove that one and put it just quicker to read, you can now expatiate. Then the other longer one, I imagine just making it 3 words. So these things are doable. So in summary for this slide, make it tidy by sticking to the at most 2 fonts designs, and the size should be 24 for the title and 20 for the body. The pictures, use pictures. I put that picture up there. Not that it's doing anything, but just to obey me that I'm presenting. Let me obey instruction. Get pictures. And we are doing clinical meetings. So if you know you are going to present about a patient that had surgery, put it up the neck with the goiter, intra up, and put up the scar as well. Have pictures, well labeled. Very important. Pictures, a picture is worth a thousand. Why should we use pictures? It makes explanation time shorter, 40 times shorter. People are able to recall 50 times more when they see pictures. They have emotional attachments when they see pictures, and they are more obedient when they see pictures. Get these pictures from your clinical work. If there's no clinical picture, look for a picture that is similar. Go online, search. This picture I got was online, I didn't snap it. If I want to present on pneumothorax and I say, hey, I forgot, I didn't snap, I'll just go online. There's many pictures of pneumothorax X-ray. I will use it. I can apologize and say, apologies, this picture is from this source. we lost our clinical picture or we forgot to snap. But this is what I want to use pictures, body language and speech. Try and gesture. You see what I'm doing? Automatically, try and gesture. Don't just stand like a military man. Sometimes you go for a scientific conference, there's a platform, a podium. Don't be fixated to it. Try and gesture around. Look at the screen. Look at your audience. Look at the screen. Look at your audience. That change in focus of the audience keeps them alert. Look at their faces and change faces. If they are professors and you are afraid of all of them, look for your colleague, somebody you like. Just look at that person and talk. So gesture, it engages the audience, it saves time. Move around, look at the screen, gesture, and then the audience follow the movement as a presenter. And as I said at the beginning, try as much as possible to speak in the third person. I'm going to use you because I'm trying to teach you. For those of you. But you can ask, as I said, a presenter should speak in the third person. A presenter should gesture. It's easier. More importantly for us in clinical settings, it is difficult to say if you go online, you will see things like if you go to search something like breast cancer, how it's treated. If we search, we will see something like Mayo Clinic and some very prominent things because they pay to have their websites up there, so they are not received. If we click there, you get things like your breast cancer may be this. Your doctor will tell you have this cancer. This is Africa. We don't like being told we have it. And it's actually not relaxed. You go to a conference, you have senior people that are presenting on prostate cancer, and that's your prostate cancer. It's not nice. At the same time, it's not nice to say, I will do this. Medicine does not like too much pride and personification. So the safest thing to do so be the third person. You can say, patients with breast cancer, patients with prostate cancer, they are alive, just push it away from yourself and your listener. So let's try and speak in the third person and avoid fillers. Thank God, I don't think I've used fillers since I played dog, have I? Somebody warned me many years ago, said, don't use fillers. You know, okay, you get it? They're not good. They can be irritating, they can push away your business. And the one very good technique to avoid using filler is not to be too fast. If you speak slowly, pause, you won't use fillers. If I want to keep talking, you need to keep talking, you have to speak in the third person, actually listen to yourself. So just speak, avoid fillers, calm down, pause for half a millisecond, filler, later. And then go to the next one. It makes your presentation more beautiful, more professional. Listen to people like Barack Obama that speak hours, very beautiful. Practice it. It's a skill that can be learned. Finally, listen to yourself for feedback. You can see that even me here, I've been adjusting the mic. Don't let them say, speak out, use the mic, put it on. You are in a presentation. As you are speaking, as I'm speaking now, I'm listening to the mic. If it goes low, I adjust the mic. If it's too high, bring it down. Adjust. Take control of the presentation. Next slide. Timing. The presenter shouldn't speak forever. People's attention span is short, about 15 minutes. Keep presentations under 15 minutes. You see, the original document I typed it for say, keep your presentation. I struck that block. It means it's not necessary. Okay, it's not necessary. Why? Average attention span is 17 minutes. D as it for the audience after 15 minutes, even for us here, our brain is the end of the presentation questions. Two parts. Something else we used to do those which can help is some presentation should be broken to 2 or 3 presenters. We are talking about management of breast cancer in health, that we can say the registrar should take the introduction, epidemiology, pathophysiology, and physical clinical presentation. Then the extra now takes diagnosis and treatment. So that time that they are changing over is the time for the audience to readjust. When they see a new face, we focus back. Then review. Nobody is perfect. Practice, practice, practice. Your presentation. If you have friends, tell your friends, let me present you. Give me a feedback. You are married, present to your husband, wife, your children. Even if you are single, you have a dog, sit down, talking to you, and stand up. Take a mirror and talk. If the presenter has done this 2 or 3 times, the topic becomes internal. Can you face the audience? It feels better. So review. And for us, one part of it is review your moderator and your seniors. Review. Send your presentation on time. If you are going for a conference and the conference organizers say all PowerPoint presentation should come on this date, on this time, send your presentation before that date or on that time. If they say all presenters should come and sit there. Note it. Shouldn't be inflicting with your presentations. Once it's time, have the presentation. So review, practice, correct typographical errors. It's not good to be saying we are supposed to write symptoms. T is missing. One thing that can help is to have up-to-date Microsoft software. It will underline. Most of us that use the craft, it will not underline. But at least if you go through your presentations 2, 3 times, you are likely to pick out those errors. Then rehearse. In summary, the background for the presentation should be single. The font should be plain, legible font size, and should be in bullet form. Use essential information only. Our advice here is try and remove prepositions as multiple of a bullet. What are prepositions? Example of is, things like that. So if I say Dr. Oide is the presenter, if I want to put that on PowerPoint, I'll just write presenter dash Dr. Oide. So that is, once you remove is, of, and all those things from the bullet, you now realize that it doesn't make sense. Then use comma or dash or something or colon, make it make sense. It will shrink it and make it better. If there's a lot of preposition in your bullet, it's very long. Let's speak in the third person and minimize space. Then there are some truths. Do not clutter the slide. Do not use completed font. Avoid superfluous information. Do not put down every word. Do not let your images be distracting. And do not use colors that are not easy to differentiate. You see, like black or blue. I see that blue and that black, it's difficult for you to really see them apart, except your eyes are sharp. But use red and black very sharp. Very important about font size. Look at the people that are in the back of the hall. Make sure they can see your slide. And always think about the audience. If you are speaking to consultants, speaking to residents, speaking to medical students, the depth of information should be different. You can't go to consultants and be defining basic things. You assume they know it and give them the latest stuff. Medical students, you can't assume they know what triple bypass is. You start from business. So essentially, that is what we have for today. Thank you very much. All this information are available. Thank you.
My question is it necessary to add numbers, like to number the presentation when you are making a slide?
The number of slides, personally, is not as important as how fast you can present it. There are some things you cannot summarize into 10 slides. Somebody can have 30 slides and finish the presentation in 5 minutes. And while somebody else has 12 slides, keeps talking. But generally speaking, we don't want slides to be more than 20, 25, 15. Once people see even 20 slides, they get worried that this is going to take a long time. As the presentation we are going to take in my units today, as at Friday, the person that sent it to me was 70 slides. He sent it to me, he said, I didn't open the slide. I said, Baba, go and reduce it. That's the first, just one. The audience you are talking to, they are not zero. If you have to put your information on 7 slides, we are talking to. We are trying to cover for both the novice and experts. If it's experts, they know the basics. So in 15 slides, your point should be then you 20 it. If they are novice people, they don't need the hyper stuff. 15 slides can give them the what is necessary. So 1 or 2 slides for clinical presentation, 1 slide history, 1 slide physical examination, 1 slide investigation, 1 slide treatment option, 1 slide prognosis, 1 slide complications, 10 slides. Then you now have the information. You can now put pictures, graphs, pie charts, Kaplan-Meier curve. Makes sense, but you now come with practice, it's too much. It's scary. The person has not done it so well. What we use in medical, the commonest referencing style in medicine is Vancouver style. In the body of the article, you have a superscript. Say, National Hospital is located in Abuja, Omeke Eta. It will be the reference at the end of the paper. But when you say National Hospital in Abuja, Omeke Eta, it's not the number 1 top of that sentence at the end. But there are other referencing techniques, methods, that some will even put the number in brackets. Some will put the name, the name of the publisher of the authors is inside it. But the commonest is Vancouver. So if it's in a clinical position like this, where that now comes in, because some people may not bother much about putting references in the main slide, but it's good to put it. Like, just go back to 1 or 2 slides. Some people will want you to put a reference here, number 1, maybe at the top, or even at the top there. But it's not always you do that. But what is important in clinical presentation is how you now write back that reference in your reference slide. There's a way it should come. So we're going to have another discussion one of these days soon about reference. Then that will sort it out. Number of slides, numbering is good. If you can do it, it's better. Because people can keep hope alive that, okay, we are going to by number 15, we're on 8, okay, let me wait, let me not slip off like neighbors. But if they just say that it's all blank, I don't know if we're at the beginning, at the middle, or towards the end. So it's always an advantage.
When we make presentations like this, and someone now commented that your slides are so scanty, no information, no any detail or something like that. So this usually worries someone when you are trying to prepare for a presentation. So, and this usually leads to bulky slides.
One professor said, this is a beautiful slide. It's good for revision for residents. Let's not mistake a lecture slide with a clinical presentation slide. They are different things. If it's a lecture slide, you may decide to make it worded for the students to read. But that is not the standard. Remember that years ago, our lecturers will write on the board, everything will be copying it. And after they read it, are you okay? Are you okay? They will just state. And then, if some of you, maybe they use pen. So Dr. Ibrahim, it is not ideal for a presentation to be too worded. But let me tell you the truth. If you put stuffy, powerful stuffy things on that bullet, nobody will tell you that it's not working. It is when you now put science, tenderness, number 2, guarding. It looks somehow. But when it's something very powerful, you have information, you have reference, you have something new. Nobody will say it's not, there's no information. So you have to balance it in between. Even if the slides are not standard, but what you have said to fill in the gap is full of information. Nobody will correct. It is when the slide is like this and you yourself, you don't have the stuff. Somebody will know that this guy is not. But this is the ideal and standard state.
The other thing I want to talk about is time management and the number of slides. At times, when you have this kind of presentation, PowerPoint presentation, you want to be under the time given to you. There's no point having 40 slides when you know that you only have 10 minutes or 15 minutes to present. Like you said earlier, it's not the number of slides that you have that's important. If you have few bullets and you have a lot of information to deliver, you'll be able to carry your audience along. Even for our departmental presentation, we try to keep to time. But a lot of the time, our residents don't obey that. That's why they always have an issue. So part of the thing you do when you are practicing, the way the duration you have. Even when you go for conferences, some of them they only give you 10 minutes to present. Some will give you 7 minutes. And in those conferences, they are very strict because immediately you start, they're going to be timed. When it's 2 minutes to the end, you're going to be warned. Exactly at the end of that time, you'll be logged out. So even if you keep talking, nobody will hear. So you're going to stop there. So if you're not used to practicing, presenting within the time, you're going to have issues. So when you are preparing your slide, there's no problem having 40, 50 slides when you know you have just 15 minutes to present. So please let's also take note of that.